Hey everybody, welcome to a special segment of Wellness Wednesday for Breast Cancer Awareness Month, which is this month. And I am here with Meena Mital, the Chief Medical Officer at NeighborCare Health. Welcome to the show.
Thank you so much for having me.
Great. So let's dive right in. So I had a couple questions here for you about breast health. So the first is, what is the best way to detect breast cancer and why is it important to check?
So the best way to detect breast cancer is to do what we would call age-appropriate screening, which really means mammograms for women in certain age groups. And it's very important to be on top of your screening as a woman because there are available treatments for breast cancer. So finding it early is really important.
And so who should get screened and how often should we be doing these screenings?
Yeah, it's a really confusing question at times because there's a lot of controversy out there. If I were to summarize, I would say women in the age range between 40 and 50 should talk with their provider about the appropriateness of breast cancer screening. There are pros and cons to doing it and different guidelines out there. But based on her history, a woman may decide to start screening in that age range. And then after age 50, pretty universal that getting regular mammograms is important. So it's good to remember that. And then I would just put a caveat that those are the recommendations for women of what we would call average risk. So if a woman has a personal history of breast cancer, a family history of breast cancer, or a known genetic mutation that increases her risk of breast cancer, it may be different and really important to talk to their provider about it.
Right. And so where can people get screened for this?
So there are all sorts of locations around the city. Many of the major healthcare delivery organizations have breast centers where you can get mammograms. And then at NeighborCare Health, we also have mammo vans, so vans that come to our clinics on a regular basis to make it really easy and convenient for women to come and get their mammograms.
And where can someone find out where a mammo van will be near them?
So the best way would be just to call NeighborCare Health, our main line, and we could help you get hooked up with a mammogram.
Great. And so personal story, when I was 20 years old, I was laying at home watching some late night television and they used to run these ads about self-exam. And so I was laying on the couch and I was like, okay, I was like doing the exam and I actually found a lump and it was super
Ooh,
scary.
yeah.
Went in, got checked, ended up just being a benign cyst and they removed it just to be safe. But do you guys still recommend the self-exam? Is that still something that's recommended?
You know, there isn't very strong clinical evidence for either clinical breast exam or self-exam anymore. That said, although there isn't specific recommendation for women to do self-exams, and again, this is an average risk women, it is a good idea to sort of know your own breasts because a lot of times women are the ones who find something that's different and can bring it to the attention of their clinicians on a timely basis. So while it's not necessarily recommended to do self-breast exams, it is a good idea to know your own breasts.
Great. Well, thank you so much for your time. This was super helpful and informative. And we will put the phone number up where people can call NeighborCare Health and find out where the mammo van will be. Oh, and I guess I had one more question. And this is just about NeighborCare Health in general. If you don't have insurance or if you are underinsured, people can still go and get this exam, correct?
Absolutely. Yeah, at NeighborCare Health, it's really important to us to serve our entire community. So we have services to ensure that we can connect people who are underinsured or uninsured.
Thank you so much for your time.
Okay, thank you.